All right, let's talk about something that a lot of us think we've got a handle on, but we might be missing the bigger picture. I'm talking about men's health. We're going to go way beyond the basics here and really build a modern guide for feeling good for the long haul. So let's just kick things off with a big question. Is just not being sick the same thing as actually being healthy? I mean, for a long time, the approach has been pretty reactive, right? We only go to the doctor when something is obviously wrong. But what if we're missing all those little signs that things are starting to break down way before that happens? And that's our first big idea here. We have to get beyond just feeling fine. It's all about changing what we consider our baseline for health, moving from just not sick to actually thriving. So, what does this new approach to men's health even look like? Well, it's really about being proactive. It's built on three pillars: prevention, catching things early, and finding balance. We're talking about optimizing not just your physical health, but your mental game too, for the long run, not just slapping a Band-Aid on a problem when it pops up. You know, our bodies are almost always trying to tell us something, long before a big problem shows up. The trick is learning how to listen to those silent signals, the subtle signs that are just so easy to brush off. Here's a perfect one: feeling tired all the time. It's so easy to just blame it on a busy work week or not sleeping well for a couple of nights. But when that feeling of being drained just hangs around, that's often a sign of something deeper going on, maybe with your hormones or your metabolism. Or how about weight gain? I'm talking specifically about that extra weight that seems to collect right around your middle. Now, this isn't just about how your clothes fit. It can be a huge signal of hormonal shifts or even a red flag for things like heart disease down the line. Okay, now here's a connection that is absolutely crucial. Feeling down, not sleeping well, or just losing your drive. We tend to separate these things out as just mental health stuff, but they are so deeply connected to our physical health. They can be a direct result of a hormone imbalance or just plain burnout. And that brings us to something that has to be part of the conversation: sexual health. A drop in your libido or changes in performance, that's not just an automatic part of getting older. It can be a really important clue about what's happening with your hormones or even your heart health. So just take a second here. Do any of these sound familiar? It's so easy to just push them aside, but honestly, just admitting, yeah, I've felt that, is the very first step to getting back in the driver's seat of your health. So if you were nodding along to some of those signals, you're probably asking, okay, so what's next? Well, that brings us to the 360-degree health check. Let's pull back the curtain on what a real modern evaluation actually involves. A real checkup today should feel like a partnership, and it has to look at the whole picture. We're talking about so much more than a quick blood pressure check. It's a deep dive into your entire system: your hormones, your heart, your lifestyle, and maybe most importantly, your mental well-being, because you can't separate them. It's all connected. And the whole process is actually pretty simple. It's not meant to be intimidating. It all starts with a private consultation where you can just be honest about what's going on. From there, you do that holistic assessment we just talked about, and all of that leads to a personalized plan that is built just for you. Okay, so you've got this personalized plan. Now what? This is where we get into the proactive playbook. This is all about making that huge mental shift from being reactive to being proactive about your health. Let's just put it side by side. Reactive care, that's waiting for stuff to break, treating the symptom, and hoping for a quick fix. Proactive care is about stopping problems before they start, getting to the root cause, and building health that lasts. Honestly, the difference is night and day. So when should you really start thinking this way? Well, here's a really clear, actionable number for you: 30. Starting to get annual checkups around age 30 is just huge. It helps you set a baseline and catch things super early when they're way, way easier to deal with. And the best news in all of this is that so much of this is in your control. These three things, getting regular exercise, finding ways to manage stress, and eating well, are the absolute pillars. They're not just nice to do, they are powerful levers you can pull to seriously support your hormones and your overall health. So at the end of the day, what's all this for? It's not just about dodging a bullet or avoiding getting sick. It's about building stronger health so you can have a better life. That is the ultimate payoff of taking charge of your own well-being. If you only take one thing away from our whole conversation today, let it be this: men's health isn't about running around fixing things that are broken. It's about prevention, it's about balance, and it's about being proactive. Really, it's about you becoming the architect of your own health for the long run. So, I want to leave you with this question. Thinking about everything we just talked about, what's one small, totally doable step you can take for your health this week? Seriously, maybe it's finally booking that checkup. Maybe it's just taking a 20-minute walk to clear your head. Or maybe it's just promising yourself you'll start paying a little more attention to what your body is telling you. That first step is everything. Thanks for tuning in.